This is Eric Whiteside with Whiteside Tactical Solution. Today, we're going to talk about March. It's an acronym for TECC. We talked about TECC earlier, and it's an actual class that we offer for you all. It's a civilian version of TCCC. So TECC stands for Tactical Emergency Casualty Care, where TCCC stands for Tactical Combat Casualty Care. But because it's a civilian version, we're going to be talking about TECC and why this is different from that of TCCC. One thing in particular is your scope of practice, where TCCC, they're able to do intubations and things of that nature, more advanced airway, more advanced procedures. And TECC, we have to go within our scope, which is the basics for all first aid CPR. But we're going to talk about that today. So we go, classified, top secret. When it comes to this, we're talking about MARCH, and the MARCH is an acronym. So what exactly is MARCH? MARCH stands for massive hemorrhage, airway, respiration, circulation, and hypothermia. But that H is separated with hypothermia as well as with head injury. So looking at these, massive hemorrhage is that uncontrollable bleeding. How can we plug that hole? So stop the bleed actually comes to play when it comes to this. Airway. When it comes to airway, do they have a patented airway? If they don't have a patented airway, is it occluded? If it is, how can we open that airway to bring oxygen into the lungs? For respiration, what does those respirations look like? When we say respiration, we're talking about the rise and fall of the chest. What exactly does that look like? Are they dipstick? Are they tachypnic? Are they cyanotic? What is going on? For circulation, that's the blood flow throughout the body. So we'll constantly have to reassess our patient as we're providing any type of care. And last one is hypothermia. When it comes to hypothermia, like say the H is split up into two, hypothermia or head injury. When it comes to hypothermia, if they're bleeding, are they cold? So we want to try to make sure they stay warm because again, when there's significant blood loss, you do get cold. Also, that H stands for head injury. During whatever traumatic incident, did they suffer a head injury? And if they did, how do we take care of that? That's what we focus on when it comes to March. Points of interest, tactical emergency casualty care, what we talked about before. The three phases of care. Of those three phases, we want to focus on tactical field care. So actually being out there in the field and taking care of that person. And then breaking down that mnemonic MARCH, M-A-R-C-H. So when it comes to tactical emergency casualty care, what exactly is it? Tactical emergency casualty care is a set of evidence-based and best practice trauma care guidelines for the civilian in a high-threat pre-hospital environment. So basically what we're saying is when ish hit the fan, what exactly are you going to do? What type of aid can you render? Because again, TECC is totally different from, I won't say totally different, TECC is somewhat different from that of TCCC because of the guidelines we actually have to follow as civilians. TECC guidelines are built upon the foundation of TCCC. TCCC came first, that's military base. And then from there, we realized there's certain things that the civilians can't do as the advanced procedures. So we modify that for the actual everyday person. So that's where TECC came from. But are different to meet the unique views of the unique needs of the civilian medical and operational environments. There are certain procedures that the civilians cannot do that the military can do. The biggest difference between TECC and TCCC is that TECC addresses civilian-specific language, provide a scope of practice. Again, that's what we're talking about, advanced area we're not allowed to do. The population, civilian liability. So again, when it comes to civilian liability, we have the Good Samaritan Act. So we have to act within that realm of our scope of practice. Civilian mission, operational constraints, logistics, and resource acquisitions. TECC is for the civilian, the EMS, and everyday citizens, where TCCC is strictly military, or I should say solely military. Phases of care when it comes to TECC. These are your three phases of care. You have care under fire, tactical field care, and tactical evacuation. When it comes to these three, we're going to focus on the middle one. Notice the colors for each one. You have your red, your yellow, and your green. Your red means that's your emergency, your hot zone. So if you take a look at the right, that's your hot zone. That's your direct threat. They're shooting at you. What do? We have to find cover. If somebody's injured and they're bleeding, our focus is just to stop the bleeding, direct pressure tourniquet. Then your tactical field care means you move into the warm zone. So you still have, there still may be danger out there. Security perimeter may have been set. So now you're able to do a little more advanced assessment to see, okay, if they're bleeding, what's going on now? That's where that circulation, airway, breathing comes to play in CAB. And that's what it says right there. Control external catastrophic hemorrhage, consider basic positioning, consider chest seal. And then the green zone is where what we call med evac. So for the military, it's called med evac, where we've taken care of them, we bandage them up, we plug the holes down, we evacuate them, get them to follow on care or more advanced care. In this case, that's going to be the hospital setting. Phases of care. For care under fire, primary concern is the threat to life, the safety, the use of the tourniquet to stop that major bleeding. And you see right here for phase 1, care under fire. For phase 2, tactical field care. This is the assessment and treatment priorities focusing on preventable cause of death. So basically, you're looking to see the worst ones first. So whoever's in the worst set, but they're still living, you want to try to take care of them first, and then get to the ones that are not as bad. So this is your follow-on assessment or your true primary assessment and treatment. And then your tactical evacuation means you've taken care of them on the field or in the area, and now you're sending them to follow-on care. Again, like I said before, TECC was developed from TCCC, so you will see a lot of military stuff in here. March, like we say, is a mnemonic. The old way of thinking airway, breathing, circulation is now out, because the biggest thing was we took a look at the airway first. If they don't have an airway, they're not breathing, we're not worried about circulation. Where now we flip that to what we call CAB, circulation. Blood must be flowing first. If blood's not flowing, they're dead. So we want to take care of that first. Then we take a look at the airway. So C, A for airway. So we'll take care of the airway next. Make sure they have an open airway. And then we focus on the breathing. If blood is not flowing, they're going to die. So you want to take care of circulation first. And in this case, phase 2, this is where your March come in. Massive bleeding, airway, respiration, circulation, hypothermia. HEM stands for massive hemorrhage, and it breaks it down, addresses. So we want to assess and address the immediate situation. If there's a massive bleeding, we want to take care of that massive bleeding. Direct pressure. If direct pressure doesn't work, then we take a look at the tourniquet and the tourniquet use. So you should be familiar with that from having to stop the bleed class to be able to assess and effectively control massive bleeding. The letter A stands for airway. Now, if you have your IFAC, you know you have your nasopharyngeal in there. That's your NPA. You may also have an oropharyngeal, but we want to focus on nasopharyngeal. You insert that if they don't have a good airway. Recovery position is either the left recovery position or the right recovery position. Patient airway. Patient with good airway, patient with airway obstruction and do not respond to basic measures require advanced interventions by trained medics. As a civilian, we do the NPA, but if they don't have an open airway or patent airway, they will need more advanced airway procedures, and that's beyond our scope of practice as civilians. Or like I said before, stands for respiration. So in your IFAC, you should have a chest seal. So if there's a massive opening to the chest, and they're having what we call dyspnea, tachypneic, or something of that nature, difficulty breathing or fast breathing, or uneven rise and fall of the chest, we want to take care of that because more likely they have a pneumothorax, and we want to plug that hole. By using a chest seal, it covers that, and then they're able to breathe a little easier. But also, when they have a pneumothorax, again, you have to get them to the hospital immediately as well. So that's one thing you want to be mindful of. Yeah, stop the bleed. If you're taking stop the bleed or a bleeding first aid course, you know how to actually apply that chest seal. Circulation. When it comes to circulation, that's your blood flowing. As we know, we're humans, we're mammals, so we have what we call a closed circulatory system. That means none of the blood is flowing outside the body. It's all inside the body, in both the veins and the arteries. So when it comes to circulation, we want to do a head-to-toe blood sweep with clean gloves. In the IFAC video, we talked about that. You want to have on light colored gloves because you have on dark colored gloves. It's hard to actually identify if there's bleeding or if it's sweat or something of that nature. So you want to make sure you have on light colored gloves. Then from there, pinpoint the wound site. exactly when you're looking at the head to toe sweep, where are they bleeding from? Once you actually identify where they're bleeding from, expose that area. Once you expose that area, you want to be able to evaluate it. Once you're able to evaluate, you then say, hey, okay, this is what's going on. Let's take the correct measures or correct actions to stop that bleeding. That's where this comes to play. Biggest thing when it comes to circulation, if you take a look, is general indicators of shock. So mental confusion. So again, they may have what we call AMS, altered mental status or state or status. Weak or absent radial pulse. So when you're checking a pulse for circulation, it's either going to be weak or thready or maybe absent altogether. So you want to make sure you take care of that. You want to be able to prevent shock by controlling the bleeding. You also want to assess and monitor for hemorrhagic shock. So if they're bleeding out, you want to be able to actually take care of that before they bleed out altogether. It's very important that we do that. Letter H stands for hypothermia. We know that when they're bleeding out, they have blood loss. When there's a blood loss, they lose body heat. So we want to make sure we wrap the patient. So looking at this, it says minimize patient contact with the elements. So you want to put a barrier between that patient and the earth, because again, we know about conduction and convection current. So if we're laying on the ground, our heat be absorbed by the ground. So we want to make sure there's a barrier there so don't lose that heat. If there's wet clothing, we want to remove all wet clothing or anything that's wet. It could be blood soaked. Either way it goes, we want to remove that wet clothing and put something on that's dry. You want to wrap the patient in something such as a blanket or something of that nature. So you want to wrap the patient in that to help prevent hypothermia. And lastly, like we said before, blood loss equal body heat loss. So the more blood you lose, the more heat you lose from the body. So we want to plug that hole. So in summary, take a look at this diagram right here. This is what it is. In the middle is your bleeding. So you have the bleeding in the middle. You can go either left or right or whatever. If you go to the left, you have hypothermia. So again, increased blood loss means they become hypothermia. Hypothermia means they're going to freeze to death. They're going into shock. So we want to be able to fix that. If there's trauma, if there's any type of trauma, there's going to be blood loss. We want to fix that. If they're bleeding, we'll call acidotic or acidosis. That means there's too much hydrogen ions in the body, so that pH level in the blood has been thrown off, made it more acidic, and now we have a problem. So we want to control that. With that said, the March mnemonic. Take a look at the right first. Massive hemorrhage. Airway, nasopharyngeal. Respirations. If they have an opening wound or a sucking chest wound, we want to fix that. Circulation. We want to control the bleeding, stop that bleed. And then H, hypothermia. Like I said before, H can also stand for head injury. That head injury comes with that trauma. The best and most effective way to evaluate trauma patients is with the March mnemonic. The traditional ABC is out the window. The airway, breathing, circulation, like I stated before, is out the window. Now we're going CAB, we'll call it CAB. Circulation first, control that bleeding, make sure they have blood flowing through. After that, then take a look at the airway. If the blood is flowing, we can keep their heart pumping. We can then create an artificial airway. Now that's for the medics. That's not for the civilian wise. The civilian wise, you're looking at a nasopharyngeal airway, or you're looking at a OPA or pharyngeal airway. Then your breathing is last, so your CAB. Your CAB, your breathing. Want to make sure they're not dyspneic, which means difficulty breathing. They're not tachyptic, fast breathing. So want to make sure they're actually good. Want to make sure they're not cyanotic. Cyanotic, earlier we mentioned that before, means they have blue tint on their skin or their nail beds or somewhere of that nature. That means they're cyanotic, is not enough blood flow, so we want to fix that. Stopping massive bleeding is the primary focus. Increasing amount of blood loss means you increase the chances of that person dying. So we want to decrease blood loss. Decreasing blood loss will decrease the chances of that person dying and increase the chance of that person actually living, which is our goal. We want to give them the greatest chance of all to survive. And lastly, train the entire March mnemonic. That's one thing that's particular. People focus on the beginning, but won't focus on the end. Hypothermia is always left out. So you want to make sure if there's blood loss, they're more likely going to suffer hypothermia because of lack of blood. So we want to make sure we take care of that. You want to train the March mnemonic until it becomes second nature. So it's muscle memory. So it's not like, okay, what am I supposed to do next? It should be muscle memory. Again, if you're taking a TECC course, like our course, we do offer this course. If you take it, you'll be fully and highly effectively trained in this. We want the care under fire, stop the bleed. We want the march, which is your first aid CPR, and then we want the evac. And we will actually practice this. Our course is different from others. We have the textbook or the theory portion, but we also have the practical portion. You must pass both to be considered a TECC provider from us. Other companies, they'll say, hey, you take the class, you're good. Not with us. You must have both the theory and the hands-on. Having that and showing great efficiency or effectiveness in both of those, let us know that you are trained and you are prepared, and you will earn one of our TECC patches that let them know that you are a TECC provider. You can do the ones online. That doesn't mean you fully understand. Come to one with the experience. We have the experience at Whiteside Tactical Solutions, so come to us for the training. You'll be fully prepared. This is Eric Whiteside, Whiteside Tactical Solution. Feel free to visit our website, www.whitesidetacticalsolutions.com, or feel free to email us at info@whitesidetacticalsolutions.com. Hope to see you soon.